The rollout of the Affordable Care Act, also known in some circles as Obamacare, continues to raise more questions as federal officials struggle to fix the web portal where people will buy insurance. Now comes word the city of Albuquerque and the county of Bernalillo will face big increases in health costs due to fees under the ACA. Other counties face this as well, certainly. Now, whether individuals are going to pay higher premiums remains open to debate. Different studies have come to very different conclusions, depending on the data they use. More than 400,000 New Mexicans do not currently have health insurance. As example, Dan, and a study by the RAND Corporation found that New Mexicans may spend more, but they will get more because of the new requirement plans to meet. Is this going to make a big dent in our numbers, huge numbers uninsured here? Are you convinced of this yet, or is there something offsetting this that gives you pause?
Well, you know, I work in the insurance field, so we've been doing a lot about getting our clients compliant with the Affordable Care Act. Before I go too far, I just want to point out that I'm wearing the light-colored suit today.
Why is this?
Well, because the Representative Antonio Mo Maestas critiqued me for wearing a dark-colored suit and said I should wear a light-colored suit. So I'm listening to the Democrat whip on my fashion advice, as you are with the nice little thing in your pocket there.
That's right. Thank you, Mo.
But he's not giving me political advice. I just want to make sure everybody knows that. Right. I do think that on the ACA stuff, though, that I think it's really interesting. You see all of the fees that are in there now, the quote-unquote taxes, you know, the Nonpartisan Institute for Healthcare Reform Study-Based Outcomes, and you know, you ask everybody about that, like, we don't know what that is. I think that what you're seeing is that, you know, there's good intentions behind trying to get people covered. Your question specifically, Gene, is this going to get these people covered? No, because almost every single one of these people, 99.9% of them already qualified for state-funded insurance, and they didn't sign up for it. We have spent millions and millions going out with ad campaigns, signing kids up in schools, signing parents up at every level.
People in general or people at the city?
I'm talking about the people he asked about in New Mexico. He said to me, in New Mexico, how's this going to affect these people that are the uninsured? And I'm telling you that overwhelmingly, they already qualify for a program that has existed. They just have not signed up for
Well,
it.
locally, as Laura brings it up, we're talking about a fee to process these things as the world works of $5.42 a person or somewhere thereabouts. Doesn't seem terribly much on an individual basis, but you know, do the math, it comes up to a pretty good chunk of change. Is this just the cost of doing business? I mean, you got to process fees. You got to, you know, process things. Is this a bigger deal than, you know, are we making this out to be?
Well, it's certainly a large dollar amount to the city. I guess one of the things that that I'm confused about, and I think there's confusion in a lot of areas for this, is I thought that, you know, as an employer, as a large employer, the city of Albuquerque was not required to comply with the Affordable Care Act until some later date. I thought there was an exemption. So I'm not sure how this is happening currently for an insurer.
That's a good question.
You know, for an employer to have to pay. I know that with small businesses, you know, and there's been obviously a lot of problems with the federal website. There's still problems with the federal website. In New Mexico, we have a hybrid system where the state insurance exchange is actually providing the SHOP, the Small Business Health Option Plan. And so they're running the website. That website's been up and running. So for small businesses, and my employer in particular, we went on it, we checked to see what would work for us and our employers, and we were able to save quite a bit over what we had before and provide a better quality plan.
I'm curious of the head count at your shop.
We have eight employees total, and right now 4 of them are full-time, and we're moving another person onto full-time.
That would not be unusual
that would be
by Albuquerque
about 5.
standards for a size of a firm.
Very small organization. So for us, it worked. Now, on the individual plan, when people go onto the website, they haven't even been able to be processed. So there's just so many problems there. But the larger employers, I thought, were exempted for some time until next year or sometime in the future. So I'm not real sure how this particular, you know, this estimate of what Presbyterian will be charging for those fees impacts them in this fiscal year.
That's right.
So,
Clary, that's a monthly fee, by the way. I should have made that clear.
I can address that. Just to be clear, City of Albuquerque is saying, in corroboration with Presbyterian, that they're going to see an increase over next year of $1.7 million over, they pay $54 million for health insurance for their employees. Right now, that's a 3.4% increase for the City of Albuquerque. And just to put that in context, the average annual premium for family coverage, and these are people who were insured through an employer, the increase in 2011 was 9% for the country. That's non-governmental. So in 2011, the U.S. population saw a 9% increase. Mayor Berry is bellyaching over a 3.4% increase.
Yeah, but that's just for fees. That's not
Yeah,
even
you-
counting
so
what's
you're-
going to happen
That's
to
just
the
fees.
premium.
Yeah,
True,
but-
that's
I mean,
just
the
fees.
premiums are
But it's-
projected
And
to
they're
go up as
self-insured.
well.
It's not
That's
that
the other problem
much.
too. They're
It's not
self-insured.
that much.
You're
Well, but it's
comparing
only $3 million.
self-insured.
It's $3 million. No, it's $1.7 million to finish out this fiscal year, and then it goes up to like one or almost
No,
two, I think, for the year.
The
And then- but for
1.7
the-
is the following year. That's the number that I.
But they are
picked.
projecting for the third year out to have that number be at 3 million, and they're not even projecting for this amount to even come down. So, I mean, at a minimum, the 10-year bill on this is going to be at least $30 million, and that's just in fees. That's not even talking about additional.
Does it make a
premiums.
difference that the fees end at some point? Like this is a nut we just have to deal with to get this thing
But
moving?
it's not
in
going to.
perpetuity? or-
It's basically a
Once the
tax on
revenue
the
starts, they're
insurance
not gonna pull
companies,
it off.
and
You
the
know
insurance
that. I mean,
company is
that's-
now relaying it back to the city of Albuquerque.
Right.
And the problem is, it's not like it's Mayor Berry's money; it's Albuquerque's money. So the question becomes: do we cut services to cover that $3 million minimum a year that it's going to be within 3 years, or do you raise taxes to cover it? So, I mean, this is exactly what's going to happen with
There's got to be more
Obamacare.
options than that, though.
But there
it would
isn't.
seem to
See,
me.
the problem
Either raising
is,
taxes or
but
cutting
there's not,
something.
Gene. The
I would
difference is
think.
the problem is that, and Sophie's right. 9%. Those are for fully insured plans, but the city of Albuquerque is self-insured, which
Sure.
means this is a fee they're paying. Then they still got to go pay the claims. They're going to write checks every month for the claims that come in. And so the problem is that Presbyterian is passing this on. This is one of 4 of these fees or taxes that have been put in. They're very specific on the Affordable Care Act that is going to tap out at about $80-something per person per month increase that has nothing to do with cost of care, nothing to do with delivering.
The city of Albuquerque, as a self-insurer, has the choice to stay with Presbyterian, has the choice to go and run its plans through other setups. As a self-insurer, it actually has a lot of flexibility. That's why it chooses
But
to
they're with
self-insure.
Presbyterian already because it's their most affordable option for the quality of service that they're getting. So, I mean, to say that they can shop, well, they can shop, but the question is, are they going to find anything cheaper? Probably not, or they would have already done it.
This is
So-
something that's being passed on by ACA. Every carrier is doing this. This is not just Prez saying. I mean, if they move to Loveless, they're going to pay this $5.
I hear what you're saying, but again, they can shop. And so you say, well, probably not. Have they done it?
They
Well,
have.
Have they done it?
They
have.
have to
Because
shop
what
it every
we're
time they renew
what
it.
we're hearing them say is like, woe is me, woe is me. We have this big new bump. But at this point, frankly, every time I hear belly aching from a Republican politician about the ACA, I run to fact check because I'm not hearing a whole lot of honesty.
I'm sure you're hearing a lot of Democrats
Well,
complaining
I
about it
don't
right now as well in Washington. There's a big call to even repeal a bunch of this stuff by Democrats. So it's not really just a partisan deal. This is not working the way the president said it was going to work. There is a lot of hurdles to getting this to work the way they say it's going to work. And I think they're finding out at the end of the day that a lot of these systems already existed through Medicaid and Medicare, and trying to create a whole new bureaucracy is leading itself to $80 a person that does nothing but feeds a bureaucry. That's one of the big problems with ACA.
When you say this doesn't work the way the president says it was going to work, I think you betray a lack, let's just say, a willingness to point the finger at one person. This came out of Congress. Both sides ended up voting for it.
Well, either way, the people that
To say
supported
this
it
is
said that we
only
wouldn't be
one
having these effects, and we
person. And I
very
don't think
much
it's
are
not
going
like
to.
for
It's going to
everyone.
affect
it's
every level. of
truly
what we pay
not.
fees.
It's truly not
There's a
a.
reason
There are
it's called
plenty of people as
Obamacare. I'm just saying.
Well, the Republicans decided to call it that for political gain.
I didn't see Bush pushing it. I didn't see,
It came from the Heritage Foundation. It ran through Romney's administration
completely
in
different.
Massachusetts.
It's totally different. And
Gonna-
that's
gonna
the
hold
spin.
it there. We have now landed in Massachusetts.
It's different because the Massachusetts pay the employers.
I hear
These
you.
guys are not paying the employers.
There's a key
Huge
difference. Here we go. We got a better subject coming now. Just ahead, we look at the impact of the turmoil at the Bernalillo County Treasurer's Office.